Hi, and welcome to AAHPO's American Armenian Health Professionals TV health program. I'm Dr. Ohan Karatoprak. This week again, we are in Emerson Armenian Nursing Home, and my guest today is Mrs. Hourig Karalian. She is the nursing director at Armenian Nursing Home. Mrs. Karalian, welcome to our program. So let's simulate that scenario for us. Let's say a patient is coming from hospital. The patient had a stroke and is being admitted to your nursing home. Let's go step by step. Patient arrives to you. What do you do?
Well, there are a few things that we try to prepare for even before the patient gets to us, right, to put the patient and the family at ease. So something new that we started, I would say, about 8 months ago is the admissions director, Jim King, and I usually go to the hospital, various hospitals, and go and introduce ourselves. And, that puts a couple familiar faces and puts somebody at ease to the new rehab facility.
Really, you're starting admission in the hospital already?
Correct, yes.
Okay. So then family feels much comfortable because they know your face now. They're going to come and see you here. Okay.
So, and this gives me a chance as a nurse to start the initial evaluation and assessment. So immediately,
yes. See who's coming.
And, from there, I also speak with the nurses in the hospital to find out exactly what happened. Although we receive paperwork here, right, nothing compares to a nurse-to-nurse conversation and your own, yes, and your own assessment. So that's how we begin.
So who decides what kind of therapy that patient is going to get?
Upon receipt of the paperwork from the hospital and evaluating the person, we're able to determine, based on how they were at home, their functional ability at home. If somebody has a new stroke, there's going to be definitely limitations that are expected. We work very closely as an interdisciplinary team. We have physical therapy, occupational therapy.
What does physical therapy do versus occupational therapy that we should let people know?
Physical therapy and occupational therapy work very closely together, although occupational therapy focuses more on fine motor skills.
Which is the hand, the
yes,
upper extremities, and the physical therapy is more lower extremities. So when they hear that they are going to get occupational therapy and physical therapy, they should know up and down therapy they're getting, yes?
Yes.
Okay.
We also have speech therapy available. We have been focusing on trying to increase the number of physician specialists that come here, because that makes it much easier, particularly if somebody newly had a stroke.
Right. Especially a neurologist to come and visit possibly.
Yes, we have a neurologist, we have a psychologist, a psychiatric nurse practitioner, many different specialties that can come here and evaluate.
What kind of prevention that you have, or what kind of things that you initiate that patient doesn't aspirate?
Sure. So aspiration precautions is a big deal. Particularly, we do have quite a number of people, whether it be somebody that newly had a stroke or somebody that has dementia or
debilitated,
G2,
really.
debilitated. So pretty much, that's on our radar all the time. Head of the bed positioning, proper positioning, sitting upright, at the very minimum 30 to 45 degrees elevation for somebody that has a gastric tube. Aside from that, we always want to watch while they're eating. Now, the food consistency is definitely important to regulate. We have a system in place to determine who needs thickened fluids versus thin fluids.
So let's go back to patient care again. How about the medications? How do you manage that?
In fact, we have the Medication Review Task Force. That's an interdisciplinary team comprised of myself, our medical director, pharmacy consultant, Mari Shamchikian, our assistant director of nursing, and all the nurses. What we do is we evaluate residents regularly at each meeting. We have 5 to 6 residents at each meeting, and we use evidence-based tools and guidelines to guide our practice. For example,
the medications that they are taking, they're on, or
correct,
they are going to be on.
Yes, so we use specifically the American Geriatric Society Beers criteria to determine if we want to reduce any polypharmacy, particularly for older adults. Certain medications, too many medications can cause poor outcomes.
And certain medications definitely is no, they should be avoided among the elderly, right?
And we try to reduce psychotropic medication use. And it's really a great forum.
And tranquilizers probably?
Yes, and so it's a great forum not only to incorporate evidence-based practice, but to also provide an area where the nurses are empowered to provide their assessments and their recommendations regarding medication use.
Which is with this evidence-based practice that you're doing, that tells us that how higher level care our patients are getting in this nursing home.
Last year in April we received the Advance for Nurses Best Nursing Team Award in the area of initiative. We got the regional as well as the national award.
Congratulations.
So thank you. And actually, since we've had such great outcomes, we also were accepted for NYU Langone Medical Center's annual Nursing Research Day conference, and we presented a poster there.
How often do physicians come and visit their patients?
So the regulation doesn't require that they come as often, at least once a month. However, we do...
For even subacute care?
Subacute care is more frequent upon admission, 5 days, 10 days, 14, 30, so depending on that. However, we're pretty fortunate because most of our physicians are very invested and they do come a lot more frequently than just the general regulation.
As far as the diet and food, usually the hospitals are notorious, quote unquote, in the good food and good diet. Being an Armenian nursing home and having at least half of the patients possibly being Armenian, do you have any Armenian food here for the patients?
We do have Armenian food. We have dolma, we have lahmacun.
Then I'm coming here next.
Okay.
Ms. Karalian, thank you very much for participating to our program. You enlightened us about this beautiful nursing home and how good, really, medical care they get.
Thank you.
Now it's time for this week's article, and it's about diabetes and eggs. Eggs contain a number of nutrients like choline, folate, selenium, and essential amino acids that may reduce the risk of type 2 diabetes. Eggs also increase HDL good cholesterol, which is beneficial for cardiovascular disease. Despite the positive value of eggs, there's a negative perception towards egg consumption. Recently, researchers from Australia compared high egg consumption, 2 eggs every day, versus low egg diet, less than 2 eggs a week, for 3 months in diabetics. And they checked their LDL bad cholesterol blood level before and after 3 months. At the end of the study, there were no differences between 2 groups in LDL bad cholesterol, triglycerides, and blood sugar levels. Conclusion of this study was high consumption of eggs did not have any adverse effect on lipid profile of people with type 2 diabetes and caused greater satiety after breakfast. 2 eggs every day can be part of dietary management of type 2 diabetics and general population. Eggs are an important source of micronutrients and essential amino acids and increase HDL good cholesterol level and may prevent age-related macular degeneration. Good health is precious and priceless. Stay informed. Visit AAHPO's website, aahpo.org, for up-to-date medical information and upcoming events. I'm Dr. Ohan Karatoprak. Until next program, so long.